Hi, my name is Lane Williams. I'm with the Animal Science Department at Tarleton State University, and today I'm going to be demonstrating administering subcutaneous and intramuscular vaccinations. Before we get started with the demonstration, I'd like to discuss the importance of choosing your vaccination, handling your vaccination, and the proper equipment to use. When purchasing your vaccination, you need to look at the instructions on the temperature that it needs to be kept at. So, for example, there are some medications that need to be refrigerated at all times, even during transportation. So when we are administering those vaccines, we have a cooler on hand that we use and place the syringes into the cooler to keep the vaccines cool and at the correct temperature. Your choice of needle is also important because of the viscosity of different vaccines. More viscous vaccines require a larger gauge needle compared to thinner vaccines, which use a smaller gauge needle. Due to lack of proper equipment, today we'll be using a banana representing the animal skin. We also will have our PPE, which will be gloves. And we also have our syringes, a 22 gauge needle, and 16 gauge needles. When injecting vaccines, it is a good habit to always wear gloves when you are dealing with certain vaccines. For this certain demonstration, I will be using a 22 gauge needle, and the smaller the number, the larger the gauge. So since this is a 22 gauge, it will be a very small needle. In this scenario, I will be using red colored water to represent the vaccine. Before we draw up the vaccine, we need to look at the instructions on the proper dosage for the certain weight of animal that we will be injecting. So for example, this is going to be a 600-pound calf. And on the instructions, it says 1 cc per 600 pounds. So we will be drawing up 1 cc of the vaccine to administer to this specific animal. When injecting the animal, we need to make sure that the surface of the animal is clean. There are no obvious signs of dirt, which can easily be wiped off with a disinfectant, such as alcohol. For this demonstration, I will be injecting intramuscular, which will be into the muscle. So for this type of injection, we will be going straight down into the animal, usually around the shoulder. For the intramuscular, it should be 1.5 inches long to reach the muscle. So you will go straight into the animal all the way down and inject the vaccine slowly. For this particular animal, it is a 1,200-pound cow, and we will be using a 16 gauge needle because the vaccine is more viscous compared to the other one. So it will be a larger needle. When using a larger gauge needle, we always want to put the pointy side closest to the skin so it causes less pain to the animal and more ease for injection. When using different vaccines, you always want to change out the syringe and needle. And whenever you are dealing with multiple animals, you want to usually change out the needle between every other animal, just to prevent cross-contamination of diseases they may have. For this particular vaccine, it requires 1 cc per 600 pounds. So since this is a 1,200-pound animal, we will do 2 cc's of the vaccine. So here is the 2 cc's of the vaccine. And whenever you are injecting and drawing up vaccines, you always want to put the needle or the cap of the needle on at all times to prevent any accidents from happening. So this will be a subcutaneous injection, which means it is injected in between the layer of muscle and skin. So when injecting, we go in at a 45-degree angle instead of straight down into the muscle. So this will be at a 45-degree angle. The point of the needle is down closest towards the skin and be injected in that manner. So inject all the way down and administer the vaccine. And immediately put the cap back on to the needle. On the instructions of each vaccine bottle, there is also a withdrawal period. So if you are using this on feedlot and stocker cattle, you need to consider the withdrawal period before slaughtering and processing to make sure those vaccines are still not present within the animal during that time. For the calf weighing 600 pounds, the withdrawal period was 60 days. So since it's not going to be slaughtered until a couple months later, it is okay to administer the vaccine because the withdrawal period is within the time of administering the vaccine and slaughtering.